Hi, Blood Talks fam. Are you preparing for your next exam in clinical laboratory science? Or just curious about how platelets and anticoagulants like heparin really work? In today's video, we're diving into some essential multiple choice questions on platelet alpha granules, heparin's mechanism of action, disseminated intravascular coagulation, and clot retraction. By the end of this video, you'll have a deeper understanding of these critical concepts and feel more confident in your knowledge. Let's get started. Which of the following is a component of platelet alpha granules? The correct answer is A, ADP. Let's talk about platelet alpha granules. What is platelet alpha granules? These are small storage sacs inside platelets that release important substances to help with stopping bleeding, hemostasis, healing wounds, reducing inflammation. What alpha granules contain? 1. Adhesion proteins. Help platelets stick to injured blood vessels, e.g. fibrinogen von Willebrand factor. 2. Growth factors. Support tissue repair. 3. Coagulation factors. Assist in forming blood clots, e.g. factor V. Breakdown of the options. A. ADP. While ADP is mostly found in dense granules, small amounts are present in alpha granules. It helps activate and group platelets to form a clot. B. Calcium ions. Stored in dense granules, calcium helps in clotting but is not found in alpha granules. C. Serotonin. Found in dense granules, serotonin helps narrow blood vessels but is not part of alpha granules. D. Coumadin therapy. Coumadin, warfarin, is a blood-thinning medication and is unrelated to platelets. In simple terms, alpha granules are like tiny bags in platelets carrying proteins to stop bleeding and heal wounds. ADP is mainly in dense granules, but also present in small amounts in alpha granules, making it the best answer. How does heparin prevent clotting? The answer is D. Heparin is an anticoagulant that works by enhancing the activity of antithrombin 3. Here's how it works. Antithrombin 3 is a natural inhibitor of several clotting factors, particularly thrombin, factor 2A, and factor 10A. It inactivates these factors and helps prevent excessive clotting. Heparin binds to antithrombin 3, causing a conformational change that significantly increases its ability to inactivate thrombin and factor 10A. This makes heparin a very effective anticoagulant by accelerating the action of antithrombin 3. Heparin does not directly interfere with the clotting factors themselves, but rather enhances the body's natural anticoagulation system, leading to reduced thrombin activity and clot formation. Why the other options are incorrect. A. Chelating calcium ions. While calcium ions are crucial for several steps in the coagulation cascade, especially in the activation of clotting factors, heparin does not chelate calcium. That is the mechanism of action for another anticoagulant, EDTA, not heparin. B. Preventing activation of prothrombin. Heparin does not directly prevent the activation of prothrombin into thrombin. Instead, it works by enhancing the activity of antithrombin 3, which inactivates thrombin after it has been formed, as well as other clotting factors like factor 10A. C. Antagonizing vitamin K's role in factor synthesis. This mechanism is the action of warfarin, not heparin. Warfarin works by inhibiting the vitamin K-dependent synthesis of clotting factors in the liver, whereas heparin acts via antithrombin 3. Summary. Heparin works by enhancing the activity of antithrombin 3, which inhibits thrombin and factor 10A, thereby preventing clot formation. This makes option D the correct answer. Which of the following is not typical of disseminated intravascular coagulation? DEC. The answer is B. Disseminated intravascular coagulation is a complex condition where abnormal clotting occurs throughout the bloodstream, leading to the formation of microclots and the consumption of clotting factors and platelets. This leads to both bleeding and thrombosis. The key laboratory findings associated with DIC include: A. Decreased fibrinogen concentration. Fibrinogen is consumed in the formation of fibrin clots during DIC. As clotting factors are used up, fibrinogen levels typically decrease in DIC. C. Decreased platelet count. Platelets are consumed in the formation of clots. so the platelet count is usually decreased in DIC. This is part of the thrombocytopenia seen in DIC. D. Prolonged prothrombin time, PT. The consumption of clotting factors, such as factor VII and others, in DIC leads to prolonged PT because these factors are essential for the extrinsic pathway of coagulation. Why B is the correct answer? Negative test for degradation products. In DIC, there is widespread clot formation and fibrinolysis, the breakdown of fibrin clots, leading to the production of fibrin degradation products, FDPs and D-dimers. These are markers of clot breakdown and are usually elevated in DIC, not negative. A negative test for degradation products would be atypical for DIC, where FDPs and D-dimers are generally positive or elevated. Summary. In DIC, you would expect to see decreased fibrinogen, decreased platelets, prolonged PT, and elevated fibrin degradation products such as D-dimers. Therefore, B, negative test for degradation products, is the correct answer, as it is not characteristic of DIC. What can cause defective clot retraction? The correct answer is B. Clot retraction is a process in which platelets contract after they have aggregated and formed a clot. This process helps to stabilize the clot and makes it more compact. For clot retraction to occur properly, platelets need to be able to aggregate, stick together, and then contract using their cytoskeleton, which is facilitated by fibrinogen. The platelet receptor 2B3A is crucial for this process. This receptor binds to fibrinogen, which connects platelets together and enables the platelet-to-platelet aggregation required for clot retraction. If there is a lack of the 2B3A receptor, platelets cannot bind to fibrinogen, cannot aggregate properly, and cannot undergo clot retraction. This leads to defective clot retraction. Why the other options are incorrect? A. Lack of platelet receptor glycoprotein 1b. The glycoprotein 1b receptor is important for platelet adhesion to the von Willebrand factor on the exposed subendothelium during the initial stages of platelet adhesion, not for clot retraction. A defect in GP1b leads to Bernard-Soulier syndrome, which causes problems with platelet adhesion but does not directly cause defective clot retraction. C. Insufficient storage of ADP. ADP is stored in dense granules in platelets and is involved in platelet activation and aggregation. Insufficient ADP can lead to defective platelet aggregation, but it is not directly related to defective clot retraction, which is primarily dependent on the ability of platelets to bind fibrinogen via 2B3A receptors. D. Absence of von Willebrand's factor. Von Willebrand factor is essential for platelet adhesion to the exposed collagen at the site of vessel injury, and it helps platelets adhere to each other during aggregation, but it is not the primary cause of defective clot retraction. Von Willebrand factor deficiency, e.g. in von Willebrand disease, affects platelet adhesion, but clot retraction is more directly related to platelet aggregation via the 2B3A receptor and fibrinogen binding. Summary. Defective clot retraction is most commonly caused by a lack of the platelet receptor 2B3A for fibrinogen. This receptor is essential for platelet aggregation and the subsequent retraction of the clot.
That's all I have for today. Did I miss anything? If you have any questions, please let me know. I'm more than happy to answer them. If I don't know, I will try my best to find out for you. Also, keep in mind that the information I put together here is the general practice at the moment. As time changes, certain practice may change, and different institutions may have different policies. So please keep an eye out for that. If you like my video and think it's helpful in any way, please share it with your friends, and I shall see you all next time. As always, remember, your blood tells you the story of your health. Thanks for watching. Bye!